Hello everyone. In this video, we will look at the difference between amoebic liver abscess and pyogenic liver abscess. Let us look at amoebic liver abscess first. So amoebic liver abscess is caused by a tropozoid called Entamoeba histolytica. The common age group happens in to be young to middle-aged adults between 20 to 50 years old. Predisposing factors are poor sanitation, traveling to endemic areas, MBBS, alcoholism, malnutrition, and the onset is gradual. The patient might present with low grade fever, presentation with dull aching pain in the right hypochondrium. Jaundice is usually uncommon. There may be moderate hepatomegaly as well as tenderness in the right hypochondric region. The patient may have a normal leukocyte count or mild leukocytosis. On aspiration of the uh, content, we will see anchovy sauce or brown chocolate colored non-offensive collection of pus. When we do a microscopy of this pus, we may find Entamoeba histolytica tropozoites present in the pus. On culture of this, there it is found to be sterile. The serology is positive for Entamoeba. On imaging or ultrasonography, we will find a solitary abscess, which is usually in the right lobe of the liver. Now, the treatment for amoebic liver abscess is metronidazole along with supportive care that is given symptomatically. So, in an amoebic liver abscess, the clinical triad is of fever, right hypochondric pain, and hepatomegaly. Typical features are is that it occurs in young adults. There is a history of dysentery which may or may not be present. Onset is insidious. Patient will have a low grade fever. The collection is anchovy sauce pus colored and responds well to metronidazole. Let us now look at pyogenic liver abscess. Now, this is caused by a mix of bacteria such as E. coli, Klebsiella, Streptococcus, Staphylococcus, etc. And it can happen in any age group, but it is common in children as well as elderly. Now, some predisposing factors which can cause pyogenic liver abscess are a patient who has a biliary tract disease, patient with appendicitis, diverticulitis, sepsis in the biliary tree, history of trauma, diabetes, etc. And the onset is acute or sudden. The patient has high grade fever along with chills and rigors and associated with pain which is severe and constant in the right hypochondria. Jaundice is usually common in pyogenic liver abscess. Hepatomegaly is marked as well as tender on palpation. The patient has marked leukocytosis along with neutrophilia and increased WBC count. When the pus is aspirated, we can see the pus is frank and yellow or greenish in color, as well as it has an offensive odor. On culture sensitivity of the pus, we will see that there is presence of bacteria or absent tropozoids on the microscopy of the pulse. It is positive for culture and there is bacterial growth. Serology is negative. On imaging study, we might see either a single solitary abscess or there may be multiple small abscesses present in the lobe of the liver. Now, for this, the treatment is administering specific antibiotics to the patient along with drainage of pus in the abscess cavity. So, typical features of a pyogenic abscess is that it occurs at any age. Onset is acute along with high fever. It can be associated with other intra-abdominal infections. There may be multiple abscess cavities which are present, and it requires antibiotics and drainage. A memory trick to remember amoebic liver abscess is that it happens in young people and slow, young age, insidious, low grade fever, and Anchovy sauce and sterile. Pyogenic is for the old and bold. It happens in any age. It is acute, high fever, pus, bacteria, and a bold presentation. Like, follow, and subscribe for more.